Social media apps should be slapped with a Surgeon General's warning label, like alcohol and tobacco. That's what the Surgeon General himself said today needs to happen in order to protect young people in this country. Dr. Vivek Murthy, who is a parent himself, says parents need to understand the mental health crisis of young people in this country is an emergency, and he says social media is an important contributor. He cites the American Medical Association peer-reviewed data that found young people who spend more than 3 hours a day on social media face double the risk of anxiety and depression symptoms. And the problem is the latest polling numbers from 2023 found this age group of 13 to 17-year-olds spend almost 5 hours a day on social media. Now, before I tell you more about Dr. Murthy's proposal and why he's suggesting this, you have to understand slapping a warning label on anything is not something the Surgeon General can do alone. He would need Congress to pass a new law to require the Surgeon General's warning label be added to social media applications. In his statement, Dr. Murthy says just by adding the label does not make the app safe. But he suggests the label would remind parents that this technology has not been proven safe, especially not for the young age group. So what kind of law is he asking Congress to pass? It's not just about the label. He wants new legislation that would block online content from young people that would expose them to harassment, abuse, exploitation, and exposure to extreme violence or sexual content. He says the law should also prevent platforms from collecting sensitive data from young people. He says the law should also force social media companies to share their data on health effects with the public so independent scientists and the government can conduct safety audits. He says the law should also restrict the use of things like push notifications, autoplay, and the ability for young people to just infinitely scroll. The Surgeon General says keeping kids safe from social media shouldn't just fall on social media companies. He says schools should ensure that classrooms and social time are phone-free, and parents should create phone-free zones around bedtime and meal times and social gatherings so their kids can understand and learn how to keep connections with real people in the real world. Now, this isn't the first time Dr. Murthy has warned parents, especially about the downsides of social media for young people. In fact, I reported on his advisory last year when he said 13 was way too young to be using social media. In that advisory, he suggested that parents should not allow their kids on social media until age 16 at the earliest. So if you want to read the Surgeon General's warning about social media, I will email it out to you tonight in my Newsgirl News Roundup email, so make sure you sign yourself up.